Good afternoon, everyone. It is so great to see all of you on this really momentous occasion. And I first of all want to recognize one of the reasons we're here today is we have a Senate leader who thought it was so important to try to give a relief, some sort of a relief valve to families that are struggling with cancer diagnosis and try to save them some money, which is so important to us. So Senator Dabo, I want to thank you for your leadership here. Let's give him another round of applause. Our majority leader of the Assembly, Crystal Peoples-Stokes, is the sponsor in the Assembly. I'm grateful for her work. I know she's very close to our friends at Roswell in Buffalo. Thank you for traveling here as well. I want to thank her. We have our Commissioner of Health, James McDonald, here. Thank you for joining us, Commissioner, as well as our Acting Superintendent, Department of Financial Services, Caitlin Asrow. I want to thank Caitlin for being here as well. And also, our representatives from the American Lung Association, Cancer Society, you'll be hearing from them momentarily, as well as survivors, family members, people who've been through this whole, the trauma of a cancer diagnosis, and also from our MSK and Cancer Center in Roswell Park, as I mentioned, are here today. This is going to be a very significant day in the lives of people who find out the news that they have a cancer diagnosis, especially lung cancer, because it puts you on a long journey. A lot of uncertainty, fear, anxiety. It's really an emotional roller coaster, something my family experienced in this space just earlier this year. So this is personal. And what we're going to do in a couple minutes is to literally sign a bill that could be the matter of life and death for families. Because a cancer screening, particularly lung cancer screening, is what gives you a new lease on life. If you get early diagnoses, if you find out early enough, your chance of survival is so high because there are treatments. We have incredible research institutions here in the state of New York and across this country who are dedicated to this work. And if you get that early diagnosis, your survival rate goes up dramatically. But we have seen that late detection can result in about a 10% survival rate. That is the difference, my friends. That is the difference right now. And nearly 14,000 New Yorkers are diagnosed every single year. And across the country, we have about 7,000 whose lives perish. So in New York, you've heard me say this often, health is everything. Your health is everything. And if your family can be spared the expense of having to come up with, maybe it's a $50 copay, but it could literally be hundreds or thousands of dollars depending on the cost involved. And so having that money back in your pocket or not defraying, or deferring going for a screening, this is going to be so significant to people. And I'm going to make sure that people know we're going to keep fighting to make sure that we have high-quality health care available to people. And that is a fight we're taking on with Washington. It feels like every single day that they don't care about people, or else why would they be talking about cutting Medicaid, which is a lifeline for people to know that they can take care of themselves or their families if there is a diagnosis like lung cancer, that they'll have the care they need, the coverage they need. Why would they even be toying with that? Why would they be increasing the premiums for people to purchase health care under the Affordable Care Act so dramatically? There's this sense of, who are you fighting for? And here in New York, I know who we're fighting for. We're fighting for everyday New Yorkers who sometimes get a twist of fate in their lives and find out that they're going to need very expensive treatments and a journey before they can recover their health. And those are the people we care about. And I wish Washington and our representatives in Washington, particularly those who represent this state, would give a damn about them as well. Everybody in this room cares. But I'm not sure how to explain the behavior and the actions of people who are so cruel and discompassionate that they would strip this away. So here in New York, we're showing what we're doing today. This is another sign that we can call upon our insurances, and in fact, demand our insurance companies to do what is right, to lift this burden of expense for life-saving lung cancer screenings from the patients, because, my God, they have enough to worry about. And if we can do that, and we will be doing that very shortly, then we'll know and reminded of who we're fighting for and why we do what we do in our daily lives. And so I thank everyone. I want to thank the Institutes of Health and National Cancer Institute, because they're out there fighting on the front lines in Washington, and they're being stripped away of essential funding. So we think about where the next innovations are coming from, where are the therapies coming from, where are the ideas coming from. We don't even have fully funded institutes of health, because again, this cavalier, depraved attitude about people's health in Washington, that we know we have more to do here in New York, that we have to make up for this, that we have to find pathways to find these cures and therapies in our own state. So we're going to keep that focus. And right now I want to call up the sponsor of this bill. I look forward to signing this, and just tell him how grateful I am. This is something that, no one ever expects this to happen. You wake up one day and everything's fine. The next day you go for a screening or some diagnosis or some sign that something's not right, and your life can turn upside down. As I said, it's something that we just came through in my own life, my own family's life. So I'm there for you. Let's bring up the sponsor in the Senate of this bill, Senator Addabbo, and thank him again for his leadership.
Thank you, Rose. Thank you. Good afternoon. Good afternoon. It is a great day. Madam Governor, I want to say thank you very much for your actions today. I also want to thank my colleague in the Assembly, Majority Leader People Stokes, for her, again, advocacy in the Assembly. I do want to thank my leader, Andrew Stewart-Cousins, Majority Leader in the Senate, and I'm thankful for my colleagues in the Senate, because this bill in the Senate passed unanimously. So we have bipartisan support. And I want to thank the advocates. I told them earlier that no one elected official does anything singularly. It is a collective effort with the advocates that we work with, that we hear from. We hear their passion, and we work on and go forward with their passion. So to all the advocates who are here today, I want to say thank you. It is because of the governor's actions today that somebody eventually in New York State will not have to make a decision between a lung cancer screening and possibly some other expense, whether it be food, or rent, a utility bill, a mortgage payment, other medication. That will not be a concern for them any longer. And hopefully with that, we can have see an increase in subsequent lung cancer screenings. And in New York, the estimate is about roughly 12,000 new cases of lung cancer will be experienced in 2025. And that's a large number. And if you look at it even further, the American Lung Association will tell us that New York ranks third in survivor and fifth nationally in early detection. We could actually help those numbers. We can get to rank closer to number one with this bill. Because with this bill, not only are we looking to statistically help New Yorkers, we're looking to save a life. And in my opinion, I firmly believe and I am confident that New York will save a life thanks to the actions of Governor Hochul. So thank you, Governor. Thank you very much, everyone. Have a great day, and thank you again. It is now my honor to introduce to you one of those advocates who worked with us and, again, was a leading cause of pushing this forward, and that's Michael Seaback.
Good afternoon. I want to tell you the story of a 14-year-old boy from Long Island. His parents sat him and his two brothers down and shared the news that their beloved 62-year-old grandfather had lung cancer. They soon learned it was stage 4. In less than 10 months, grandfather went from his diagnosis, he was a vibrant young grandpa, to quickly having the cancer ravage his body and be the cause of his untimely death. That 14-year-old boy was me. Lung cancer screening wasn't around for my grandfather, but it is now. And I've worked for the American Lung Association for the last 20 years to improve lung health. Lung cancer screening saves lives. The American Lung Association applauds Governor Hochul, Senator Addabbo, Majority Leader People Stokes for their leadership in helping remove a financial barrier that could prevent someone facing lung cancer from accessing life-saving care that they need. By eliminating this obstacle, this law will help ensure less people have stories like mine, that more people become lung cancer survivors, and it brings us closer to defeating this disease. Thank you. I'd like to hand it to my colleague, Michael DeVoli from the American Cancer Society Cancer Action Network, who has worked tirelessly with advocates to push for this bill. Thank you.
Good afternoon. Thank you, Governor, thank you, Senator, and thank you, everyone, for being here. My name is Michael DeVoy. I'm the Senior Director of Government Relations for the American Cancer Society Cancer Action Network. I would just, obviously, when you think about a cancer diagnosis, there's nothing scarier than sitting across the table from a doctor and being told that you have cancer. The only thing that I could imagine being scarier is to be told, or is to realize that you may not be able to afford the treatment or the additional screening or scans to help figure out what is the best course of care. Because that moment right there, you are left without hope. New York State, as has been said, there are over 13,000 New Yorkers that will be diagnosed with lung cancer every single year. Only around 21% of the recommended screening population are getting screened for lung cancer in the first place. As a result, more people die from lung cancer than any other type of cancer. This bill, the actions by the governor today, the actions by Senator Dabo, Assemblymember Crystal Peoples-Stokes, and all of the advocates today are going to help turn that around. So I just wanted to say thank you to everyone. I want to say thank you especially to the lung cancer survivors that are joining us here today. It is your voices, your stories that have motivated us every single day. This bill is a historic bill, making New York State only the second state in the entire country to take such an action. And as a result, lung cancer will now be treated the same way that breast cancer, colorectal cancer, prostate cancer, and cervical cancer are all treated. This is an incredible day, not just for the enactment of this bill, but it sends a message to the rest of the country that you should do what New York just did. You should follow New York's lead. And thank you, Governor Hochul. It is your leadership that has gotten us here today. Thank you very much.
All right, let's sign the bill. Please remain seated as we sign.